Efforts to form partnerships fully equip the New People's Hospital to offer essential services, modernize and upgrade the healthcare system are all part and parcel of the BVI Health Services Authority effort to build a better healthcare service in the BVI. To deliver the optimum quality of service, Chairman of the BVI Health Services Authority, John Klein, says will be done when the Health Services Authority brings in more revenue, which means higher cost for healthcare.
Fees in the health services in the BVI has not probably been upgraded since the 60s or somewhere there.
Yeah, like $25 a bed.
Yeah.
Yes,
Yeah.
yes, exactly.
$25 a bed, not for a bed, $25 a night for a 24-hour nurse for 3 meals a day,
yes,
plus the bed and everything else that go along with that.
Doctor's visit.
And you know, it's just not sustainable. And if we expect government to continue to subsidize that, then the quality will continue to remain at a substandard level. If we can't raise revenue to deliver the service that's necessary. So, and because we can't do that, people go off island and pay more. Whereas if we can charge something a little more reasonable and in line with the cost of delivery of service, then we can deliver that service, and they won't have to go off island as often.
A new fee structure has been submitted to Health Minister Ronnie Skelton to be approved by Cabinet. The National Health Insurance Plan is expected to help residents to afford their health care services. Darlene Carty-Baptiste, Chief Executive Officer, says the authority is also looking at upgrading and strengthening other areas, such as the health information system, as the authority seeks to build an accredited healthcare system.
I mean, it would actually revolutionize the healthcare services here in the BVI. One patient, one record. It kind of modernizes the system. The fact of, you know, the lab results will be filtered to the physician or the practitioner more swiftly. The same thing with the x-rays, all the standing orders, again, in real time, so we don't have the delays in that manner. The fact of even risk management, from a practical point of view, with documentation, it kind of forces a practitioner to properly document the patient's manifestations or during their assessment, so you have like a standardized way of inputting the information. And we can't stress how critical this is.
Yes.
Looking at from a quality measure for healthcare. The fact of, you know, even looking at medications, you know, folks kind of forget what they on, how long it took it.
They don't bring, the old people don't bring their medications with them. You don't know what was prescribed before.
Yes, all of that is already in the system. Your history, so you don't actually have to do like serious recall, the memory, everything is there. One thing that also comes up is the issue of confidentiality. Everyone doesn't have full access to your record. It's only based on a need-to-know basis. So there are tiers of security that's built in.
The Specialty Services Partnership formed with Puerto Rico-based HEMA will allow for specialists to visit the BVI once a week. Local doctors are also being trained by the specialists to perform assessments.
Overall, we have our specialty clinics that, as a part of our service, that we've expanded over the last year and a half. So with that in mind, we're expanding to specialty services or subspecialty services that we currently don't have. So we actually partner with them within the first phase. We're bringing over nephrologists. So we actually will strengthen up our renal clinics. So we actually have that kind of interaction with our dialysis patients every week, versus what were the conditions we had before with an outside vendor. We're also doing neurology, which is awesome. For those persons who may be borderline strokes, we're actually going to strengthen up our telestroke unit. The thing is, even though the specialist comes in from HEMA only once a week, we're actually going to partner them with existing physicians in our system, so that actually they will train up, so they can actually do initial assessments and everything else. So in the absence of them being not here from whether it's a Monday, Tuesday, Wednesday, someone within our current system would actually have the skill set to do the assessments.
Once the New People's Hospital is completed, transitioning into the new facility will be done on a phased basis. moving one section at a time while maintaining operations at the Old People's Hospital. The Health Services Authority officials say they want to hear your comments and complaints about the standard of service being offered as they work to strengthen the BVI health system.